Well, thank you for that introduction. My name is Ellen Kim. I'm a clinical informatics fellow at Mass General Brigham and a radiation oncologist at Brigham Women's Hospital Dana-Farber Cancer Institute. And I primarily treat GU patients. So this is something I think about every week. This project was the use of patient-reported outcome data to develop a personalized patient education tool for prostate cancer. We all know that prostate cancer patients usually have multiple equally effective management options, and shared decision-making is the standard of care, but patients can be overwhelmed with information after a stressful diagnosis, especially if they're meeting 3 different specialists in a multidisciplinary clinic back to back to back. And our past patients provide the best estimate of what our future patients will experience. And studies of cancer patients have shown that clinicians underestimate the side effects that patients are actually experiencing. But now we should take advantage of real-world evidence, patient-reported outcome data, and clinical informatics to create better patient education resources. So for this cohort, we started with prostate cancer patients who received conventional 9 weeks, moderately hypofractionated 4 to 6 weeks, or salvage 8 weeks of external beam radiation in our department between 2016 and 2021, and took information from our departmental database, as well as pro-responses from our enterprise data warehouse, focusing on questionnaires from weekly on-treatment visits to see side effects during treatments in the short term. So combining these data sources, we found about 1,600 patients who had submitted more than 10,000 OTB questionnaires for an average of 6.2 questionnaires per patient. We explored patterns within these data for temporal trends and what was associated with more severe side effects, and found that one of the most significant factors was the baseline symptoms before starting treatment. So with this in mind, we explored visualization strategies with unstructured interviews with physicians, with nurses, with data scientists in medicine and outside of medicine, and data visualization experts, and built a prototype patient education resource using R-Shiny. So this is a screenshot of the working prototype. It is 2 simple tabs. The first tab shows symptoms today, so patients would fill this out at consultation. And it's the same 14 questions that we ask patients at weekly on-treatment visits, focusing in the domains of urination, GI, and general. And so patients can go down through this list of 14 questions, a little bit edited here to fit in one screen, but they would scroll down. And for this example patient, let's pretend that they had absolutely no symptoms. So all the way down on the left-hand side, minimal symptoms before starting treatment. And then at the bottom, they can click View Expected Side Effects. This would take them to the second tab, where the darker color shows what they will probably experience during the 9 weeks of radiation. So this is based on all of the previous patients who also answered with the same answer for each question for minimal symptoms. You know, how did they do overall? Right now, conventional 9 weeks is checked. And you can see the same 14 questions in the same order and left to right, left being minimal symptoms, how previous patients who started with no symptoms did. And if we focused on this question, how often will you urinate at night? For patients who said seldom or never initially, most of them stayed in the seldom or never, or maybe 1 to 3 times at night. And maybe these 2 rectangles are a little bit darker, a little more intense. So more often 1 to 3 times than 0 times, but very rarely more than 3 times at night. And just for comparison, this is what's in our current patient education and consent forms. In the short-term reactions, commonly, you may need to empty your bladder more often, particularly at night. And I think this is a more vivid illustration that patients can imagine, how will this affect my life? How common is common and how much more often is more often. And coming back to this section, if maybe they're a good candidate for hypofractionation as well, if you check this box, they can see side by side for the same questions, conventional 9 weeks on the left, 4 to 6 weeks on the right, how their side effects may differ with one versus the other. So this is still very much a work in progress, but I think we are ready now to start asking patients for feedback and incorporating their ideas and see, make sure that this is understandable and not over-interpretable. We definitely plan to add long-term problems like EPIC 26 questionnaires, and doing so will facilitate adding other management options, including radical prostatectomy and active surveillance, and also shorter radiation treatments like brachytherapy and SBRT, which would have only been one on-treatment questionnaire. We plan to add additional clinical information and incorporate significant ones in further personalization of side effect predictions. The dream goal in the future would be to implement this in our clinic and eventually expand it to other types of cancer as well. So thank you all for your attention and the ROECSG organizers for the opportunity to present this work.